Cigarettes aren't good for us. That's hardly news. We've known about the dangers of smoking for decades, but how exactly do cigarettes harm us? Let us look at what happens as their more than 5,000 chemical substances make their way through our body. From the moment we inhale, the smoke star, a black resinous material, begins to coat our teeth and gums, damaging tooth enamel and eventually causing decay. Over time, smoke also damages the nerve endings in our nose, causing loss of smell. Inside the windpipe, smoke irritates the mucous membranes, increasing the likelihood of infections. The tiny hair-like structures in our airways called cilia are also there to protect us from infections. They sweep away any debris or inhaled particles, but the smoke paralyzes and eventually destroys these cilia, leaving us defenseless against infections. In addition, the immune system weakens over time, leading to chronic respiratory diseases such as bronchitis and emphysema. The toxic gas carbon monoxide is another hazard of cigarettes. As it travels through the lungs, it crosses the membrane into the blood, binding to hemoglobin, the oxygen-carrying protein, and displaces the oxygen that it would usually have transported around the body. This is one of the reasons why smoking can lead to oxygen deprivation and shortness of breath. Within about 10 seconds, the bloodstream carries a stimulant called nicotine to the brain. Nicotine stimulates the release of dopamine and other neurotransmitters, including endorphins that create the pleasurable sensations which make smoking so addictive. In the brain, nicotine also causes the constriction of blood vessels, which deprives the brain of oxygen and triggers the release of adrenaline, which increases blood pressure and heart rate. At the same time, other chemicals from the cigarette cause constriction of blood vessels throughout the rest of the body and damage their delicate endothelial lining, the inside layer of cells that lines our arteries. This restricts the inner diameter of the blood vessels, forcing the heart to work harder and can lead to high blood pressure. The long-term effects of smoking, including coronary heart disease, peripheral vascular disease, and stroke, are all consistent with this type of damage. In addition, the carbon monoxide and particulate matter in cigarette smoke damages the inside layer of cells that line our arteries, causing a condition known as atherosclerosis. In this condition, fatty acid deposits accumulate in the artery walls, forming a plaque that blocks the normal flow of blood through the arteries. Plaque can also rupture, triggering blood clots that completely block the artery, causing a heart attack. When a smoker quits, beneficial changes begin to happen almost immediately. Within 20 hours after the last cigarette, carbon monoxide levels in the blood return to normal. Within 2 to 3 months, the circulation improves and lung function increases, allowing for greater oxygen uptake. Within 1 to 9 months, coughing and wheezing decrease, as do the frequency and severity of respiratory infections. Within 1 year, the risk of heart disease is reduced by half, and within 5 years, the risk of lung cancer is reduced by half. Giving up smoking is one of the best things we can do for our health. If you're a smoker, don't wait another minute to quit. Your body will thank you for it. For more information on the dangers of smoking, visit our website. If you liked this video, give it a thumbs up and share it with your friends. Subscribe to our channel for more videos like this. As always, thanks for watching.